During this COVID-19 third wave, we've heard a lot of numbers, from case counts in the ICU to the percentage of people getting vaccinated and to rates of spread for the variants of concern. With us to better understand these facts and figures, in the provincial capital, Dr. Isaac Bogoch, infectious diseases physician at the University Health Network and a scientist based out of Toronto General Hospital and the University of Toronto, and Ashleigh Tuite, infectious disease epidemiologist at U of T's Dalla Lana School of Public Health. Welcome back to you both.
Thank you.
Thank you.
It's been a week, lots of numbers to get into. If the director could please put some of these numbers up. So we wanted to compare what's going on now as opposed to last year, April 29th, 2020, and then the third wave, April 29th, 2021. So the number of people in ICU beds during the first wave was 235. And this third wave, we have 884 as of April 29th. The number of people on ventilators in the first wave was 186. In this third wave, we have 620. The total number of deaths during the first wave was 996. This number in the third wave is astounding. It's 8,029. The total number of cases during the first wave was 15,728. And this third wave, it's 459,447. The number of new cases during the first wave was 347 on April 29th, 2020. On April 29th, during this third wave of 2021, we have 3,871. Lots of numbers to break down, and I'm so happy that you both are here for us to help us understand these numbers. Ashleigh, I wanted to start with you. Would you have thought this is where we would be a year later?
Honestly, no. I mean, looking at those numbers and thinking back to where we were a year ago, at that point in time, we were all really scared and, thinking about this, as we didn't really know what was in store for us. I think we knew we had this new infectious disease. We knew that if we didn't bring it under control, that things would be a lot worse than they were back last spring. But at the same time, I think I had more optimism in the sense that we would have sort of understood the virus and been better at controlling it. I think, that the pandemic has changed a lot in Ontario. Back in the spring, most of those cases were happening, or at least in terms of, the deaths were happening in long-term care homes. And that's really shifted. And, the fact that, we're more than a year out and we're, experiencing the worst wave of infections that we have since the start is not something that I would have predicted.
And it's shifted for, I guess, a number of reasons. We're going to talk about vaccines in a little bit. But Dr. Bogoch, when you look at those numbers, what goes through your head?
Obviously, the third wave has been extremely challenging. I think it's important to remember that some of those numbers are cumulative numbers over the entire course of the pandemic and not just reflective of the third wave. So that's an important caveat here. But having said that, regardless of how we look at it, the third wave is tough. I mean, we've never had this many cases of COVID-19 than ever before in Ontario. Our healthcare system has never been this stretched beyond capacity. Like, when have you ever seen adults admitted to pediatric intensive care units or tents set up outside of hospitals so we could deal with an influx of patients, or canceling surgeries throughout the province so that we have an all hands on deck approach, or bringing in healthcare workers from other provinces to really help out? I mean, by any metric, this third wave is more challenging than the first two waves. Unique challenges, but some similar challenges as well.
Do you think, I'm not going to ask if we would have avoided the third wave, but do you think it could have been less if we had done different things?
Yeah, absolutely. Absolutely. I think there was going to be a third wave or a third wavelet, and a lot of this was preventable. A lot of this is related to policy in terms of just giving this virus an opportunity to transmit. Now, variants of concern were encroaching on the ratio of COVID-19 or SARS-CoV-2 cases in the province, and I was going to say gradually encroaching, but they were actually rapidly encroaching, and certainly made things more challenging. Having said all that, people are often treating this as that's a new virus. It isn't. We know how it's transmitted. We know where it's transmitted. We know who's at risk. We know neighborhoods at risk. we know how to keep this under control. Yeah, it's a little bit harder to keep it under control with more transmissible variants of concern, but we still know how to keep it under control. So I would say that some, but not all of this was preventable. I don't think we needed to be where we're at right now.
And Ashley, as Dr. Bogoch said, obviously some of the numbers are going to be higher just because there's been more, it's been a cumulative effect. When you look at what's happening in the third wave, what do you want people to know about the numbers that maybe we won't be able to really understand when we look at them?
I mean, I think the really important thing when looking at those numbers is to try and take a step back because, I look at those numbers every day and you get a bit numb to them. I think, if we had told people a year ago that we were going to see 3 or 4 thousand new cases a day, that would have been pretty shocking. And at this point, we're numb. We've seen those numbers, we look at them all the time. And so I think it's really important to remember that, there are people behind those numbers. And it's really important to remember that, each of those people in hospital and each of those people who are in ICU or each of those deaths, those are real people, and they have families, they have people who love them and care about them. And so as much as, we're all tired and fatigued and, are sort of more, I think the goalposts have changed in terms of our willingness to accept the number of cases that we're having. We need to remember that this is affecting people. It's affecting, the people who love the people who are infected, as well as, healthcare workers and people who are treating them. So it's, I think it's really important to look beyond the numbers.
And Dr. Bogosh, this past week it was reported that Michael Garn Hospital was transferring their patients to other hospitals because of concerns of low oxygen supply. They had 20 intensive care patients in a 17 bed ICU. 7 patients were sent to 2 other hospitals, Sunnybrook and St. Mike's. What do you want people to know about what you're seeing on the ground?
Yeah, a couple of points. Obviously, I mean, like this isn't a costume. I mean, we're all working like dogs in the hospital. It's not just doctors and nurses. There's huge teams of people working. The allied healthcare providers, your physiotherapists, your occupational therapists, your speech language pathologists, your respiratory therapists, your pharmacists, and on and on and on. And then, of course, there's the non-patient facing group as well. There's, people who keep the hospital going. There's the laboratory experts. There's the people in shipping and receiving. There's the people who are cleaning the hospital. Like healthcare providers with that huge umbrella that encompasses all the, we're all exhausted. And of course, we're not unique. Everyone in Ontario is exhausted. But, it's busy, to say the least. It's busy. There's a lot of patients. You can talk to any front-facing healthcare provider. We've all had our share of very tragic cases and Zoom deaths and tough family meetings, and it's been tough. It's been very tough, and it's been a very long pandemic. Interesting when we talk about this situation at Michael Garn Hospital. First of all, I'm at Toronto General. I'm not at Michael Garn. Secondly, I'm not an expert on oxygen or supply chains of oxygen, but I mean, obviously that raised a lot of eyebrows. Full disclosure, I just called a bunch of people that know a lot more about this than I do and asked them, what's the deal? It sounds like that's a very local issue. It doesn't sound like this is a more systemic issue. And I don't think we're going to see much more of this in Ontario.
How are you coping? What keeps you going through this?
Chicken wings and Lagavulin? Wait, no, sorry, that's not the right answer. Lucky this is being recorded. No, I mean, in all fairness, I'm I don't want to give the knee-jerk middle-aged male answer of I'm fine, but in all fairness, I actually am. Like, you get up, you put on your work boots, you go to work. I mean, days are busy, that's for sure. There's some days that are better than others, that's for sure. But personally, I'm actually doing okay. I'm exhausted, but I'm doing okay.
And Ashley, how are you doing?
I'm fine. I mean, I'm not on the front lines. I have the privilege of being able to work at home, and I think for me, I feel pretty helpless. I want to be able to help more, and I can't. The best I can do is sort of share the data that we have and try to make projections about what may be happening in the future and try to advocate for people who don't have a voice. But beyond that, it's really I'm sort of part of the audience in terms of watching what's unfold in the province.
Well,
I don't mean to
this week,
interrupt. May I add
yes,
one other thing? I'm
of
so
course.
sorry. Just because my last comment, like, just because I'm fine, I mean, just stating the obvious, it doesn't mean everyone's fine. Like, we're not fine. And I think there's a lot of people who are struggling, and some of it's more obvious than others. And this is everybody. It's not just healthcare providers. It's your friends, it's your neighbors, it's your family. And, like I mentioned, I don't think it's very obvious. Sometimes it is, but a lot of the time it isn't. And I really hope people take an opportunity to really meaningfully check in on others, not just the hey, you doing okay kind of check in, but like a meaningful check in to see how other people are doing. And because it's clear that we're not okay, and people do need help. And I hope people are accepting of help, and also reaching out to others to truly see how everyone else is doing.
And also, too, I think we should mention that, there does seem to be a little bit of good news. This week, Christine Elliott announced yesterday that towards the end of May, vaccines will be available for those aged 18 plus. Ashleigh, how close does that get us to an end to this?
I mean, it is good news, and I think we need to celebrate the small wins right now. The reality is that by the fall we should have most of the population who's able and willing to get vaccinated fully vaccinated. And so, we are going to see a decline in cases. We're already seeing a decline in cases. That hasn't translated into what we're seeing in terms of hospital and healthcare demand. But we're headed in the right direction, and vaccines are going to help with that. They're going to help a lot. I think the thing that's really important to keep in mind is that, despite the vaccines and our desire to just get over this, we need to be aware of the fact that we are going to have to continue to have public health measures in place, at the same time that we're vaccinating. But I do think that, come the fall, we are going to be in a much better position than where we are right now.
Do you have any concerns about getting us to herd immunity?
Yeah, I think it's increasingly unlikely that we will reach herd immunity. And I don't think that's a bad thing. And I'm not saying that sort of as a way to scare people, but I think, a lot of the conversations that we hear is, once we get X percent of the population vaccinated, and those targets move a bit depending on if we're talking about the new variants, which are more transmissible, which means we need more of the population with immunity. Once we reach herd immunity, magic will happen and we'll throw open our doors and everything will be good again. The reality is that even if we don't achieve herd immunity, once we have enough of the population vaccinated, the vaccines work really well. They work really well at preventing severe outcomes. And even, before we reach that threshold, it's going to have an effect. It's going to result in a decline in the number of cases that we see. Throughout this pandemic, we've been talking a lot about exponential growth. The flip side of exponential growth is that we can also see exponential decline. So once we start having enough immunity in the population via vaccination, along with these other public health measures, we can start seeing pretty rapid declines in numbers of cases. So, herd immunity is a thing to aim for. And I think in the longer term, having high levels of immunity in the population is really important, but it's not the end all and be all.
And Dr. Bogoch, how important is it to stress the fact that after you get your first vaccine, that you're not fully immune to them? Even with that, we know that's true, but we're hearing a lot of stories of people stopping their physical distancing, wearing masks, and how important is it to get that message out?
Yeah, it's extremely important. We know that one dose of a vaccine, doesn't matter which vaccine it is, one dose of a vaccine is really helpful, but it's not the same as two. And you really need to have two doses of these two-dose vaccine series to realize the full potential of vaccination. So after one dose of a vaccine, we're not invincible. You still have to adhere to these public health measures, and it's extremely important. And listen, the one dose vaccine does a few things. Just like two doses vaccine, it reduces your risk of getting this infection, just not the same as two dose. It also reduces your risk of getting sick and being hospitalized. Just again, not the same as two doses. So, vaccines are pouring into the country. We will all get our second doses. Some of us, for many of us, will still need to get our first doses first too. But this is going to happen, and I think the real inflection point was actually about a month ago. March 22nd was when we went from a trickle of vaccines into a river, and now as we move into from late April into early May, that is going to pick up the pace even more. And then, of course, we know with vaccine shipments in June, that's going to grow even more. Like, it's likely that we're going to get our second doses for many, not everyone, but for many of us, we'll probably get our second doses before 4 months. Don't hold my feet to the fire because I'm not 100% sure on that, but I think that might happen.
I mean, Gen X always seems to get ignored because I'm Gen X. I will take the opportunity to say that, a lot of us, when the AZ became available to our age group, we did take it. But we have seen, Dr. Bogoch, lineups for vaccines in communities that have been accused of being vaccine hesitant. Brampton has been begging for more supply of vaccines. And this past week, we heard this tragic story about a family that was forced to pay a private company to bring their family member's body home after he was transferred to a hospital in Ottawa and later died there of COVID-19. I can't even imagine getting a bill for someone who has died in this pandemic. And then there's been the sick day battle with the government, and they finally conceded this week, but experts are still saying that it's not enough. Dr. Bolgosh, I don't want to put you on the spot, but you've advised the government in its response to this. At what point do you feel that what you're doing isn't effective? And have you even considered maybe just quitting if what you're suggesting is not being taken into consideration?
I think it's important to recognize that you can do a lot more with a seat at the table compared to shouting from the sidelines. So, listen, I mean, it's no secret. I do advise, and I'm not really private about what I advise. I'm pretty public in media and on social media about what I stand for, and that's what I stand for. Sometimes they listen, sometimes they don't. You truly can make meaningful changes with a seat at the table, and I'm privileged and happy to have that. And I'll just keep pushing.
What do you say to people in Ontario? There's been so many people who are, for the majority of Ontarians, they're doing the right thing. But we're talking about numbers. We see all these numbers. Right now, it just feels like a really heavy time, and people feel helpless because, we're not politicians, and maybe some people feel like they're not in control of what's happening. What do you say to them about how to hold on in these moments?
There's objective measures that this is getting better. Like, it actually is getting better. It's not about to get better. It's getting better, right? We are seeing small but real metrics pointing in the right direction in terms of the case numbers, in terms of vaccines rolling out. Listen, it's far from perfect, but we are starting to head in the right direction. I appreciate that people can feel helpless at times and not in control. And the reason they feel that way is because they really aren't in control. They aren't. You can only control certain things related to what you do in your behavior, right? You can control putting on a mask going into a grocery store. You control, not going over for a social gathering inside your neighbor's apartment. But other things are beyond our control. Essential workers have to go to work, right? But government policy is well beyond many of our reach to alter, and that can be very challenging. I appreciate that. That can be very frustrating as well. Having said all that, all pandemics end. The pandemic in Canada is far from over, but it is winding down. And I think it's going to be very interesting. Like, we're almost in May. It'll be very interesting to see what the beginning of May looks like versus the end of May. I think that we're
Interesting
really
good or
in
interesting bad?
Oh, good. Like, significant, positive, transformative changes throughout the month of May.
Okay. Because I think one of the questions has been a lot of concern has been our healthcare system being overwhelmed before the third wave is over. Are you concerned
Yeah,
about that?
yeah, I'm living it right now. I mean, it's busy, and we're getting transfers from other hospitals, even in the GTA, that are overwhelmed. our friends and colleagues at Sunnybrook are now working in a tent in front of the hospital. My friends and colleagues who are intensive care unit doctors for adults are going over to the sick kids hospital to see adult patients in their ICUs. Like, the system is overwhelmed. I think it's also important to note that for people who are watching, that doesn't mean the hospitals are closed. We're open. We never close. If someone's sick with COVID-19 or not, and you need attention, come on in. Our doors are open. We're happy to see you, and you will get care for sure. All it means is that essential surgeries and scheduled surgeries are being canceled. Resources are being diverted to really care for an influx of patients with COVID-19. We're extremely busy. We're extremely tired, but we're still here, and we're still happy to help. And that means for non-COVID-19 related issues as well, heart attacks, strokes, and you name it, we're here to help, and the doors are open. So I hope the message.
I'm glad you said that. I'm glad. I think it's important for people to hear that. We only have a few more minutes before we wrap. But Ashleigh, this past week, the world witnessed what's happening in India. Horrific images coming out of India. The daily cases are astronomical. I think in one day there was over 350,000 cases in just one day. What crosses your mind when you see those reports coming out of India?
I mean, I think I'm with everybody else who's seeing this, which is, there's profound sadness and also, I think, anger that this was allowed to happen. What we're seeing unfold in India is predictable in the sense that that's what happens when you let the virus spread unmitigated, if you don't do anything, or if you do sort of minimal action. And what we're seeing in India is really probably not sort of the tip of the iceberg in terms of, we know that there's profound underreporting. But what happened there is, I think, what can happen in a lot of places, including what is happening in Ontario right now, is that we have this sense of exceptionalism, that for some reason the virus behaves differently in a particular area. And, in India, they didn't have a large amount of virus spread throughout the winter. And so, the thought was that they had immunity and that, somehow they would avoid a subsequent wave. And they ignored early signs that actually the virus was spreading. They were seeing increased cases. And, they delayed doing anything. And so I think, it's heartbreaking, and it's also a cautionary tale, which is that, we need to continue to remain vigilant and not have this sense of, false optimism that, just because things look okay right now, that, the situation can't change, and it can't change really rapidly.
Do you worry like that would happen here?
I mean, to be honest, I think it's sort of what we've seen in Ontario. That's what the third wave was. It's not to the same degree, obviously, because we have responded, but it's really easy to tip into these really catastrophic situations, and so we're seeing it on a smaller scale in Ontario. So I mean, it's not really a hypothetical at this point. I think it's, again, and India is the latest example, but we saw it in New York, we saw it in Italy, we saw it, we've seen it, and we'll continue to see it. And it really is this reminder that, until we have immunity, until enough of the global population is vaccinated, we're all vulnerable.
And Dr. Bolgosh, I'll let you have the last word. We've got 20 seconds left.
This will get better, and it'll get better on the sooner end rather than the longer end. Vaccines are rolling out, case numbers are going down. If we have decent policy and don't reopen too fast, we'll be okay.
Thank you so much to you both. We really appreciate you coming onto the program. And also, we know you're very busy and you always make time for us. We're very, very grateful. Thank you.
My pleasure.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.